With the experience and resources for cases throughout Louisiana, Walters Papillon Thomas Collins, LLC, is proud to support LPB, specializing in personal injury and wrongful death, with information at lawbr.net.
Good morning, everyone. I would first like to thank all of our healthcare providers who are joining me and practicing social distancing this morning and taking part in this important community testing center. Thank you to the Baton Rouge Clinic, Baton Rouge General, Ochsner, Our Lady of the Lake, and Women's Hospital. Now, since we opened the MOSEP community testing site on March 16th here at the Baton Rouge General Mid-City campus, we have provided tests for 904 people. This is a solely local effort between my office and these healthcare providers. Right now, there are very few communities who have been able to stand up a drive-through testing site like this. This site brings hope to our community and much needed relief to hospital emergency rooms. I wanted to update everyone about the results of these tests. Because of the high demand for testing across the country, it is taking about 7 days to get results. Now, those results go directly from the lab to the ordering physician and from there to the patient. Confirmed cases are reported to the Louisiana Department of Health. Healthcare providers make the decision whether or not to order a test for their patient. Because of the shortage of tests across the country, physicians are being judicious in who they order a test for, with the goal, of protecting the most vulnerable patients. For example, I have not and am not seeking a test at this point because I don't have symptoms. With that being said, we should all act as if everyone is positive for COVID-19 and practice social distancing. This will help save lives. As of this morning, East Baton Rouge Parish has 58 confirmed cases of COVID-19 and 2 deaths according to the Louisiana Department of Health. We expect those numbers to keep going up in the days ahead. New Orleans and Jefferson Parish are in a critical state right now. They're expected to surpass 1,000 confirmed cases today, and their death toll is already more than 30 people. These are our fellow Louisianians, and we should hold them in our prayers. East Baton Rouge Parish could be next, but I am hopeful and optimistic that we can flatten the curve and save lives. That's why we are continuing our message. I know it sounds repetitious and we continue to say it over and over, but what we need people to do is to stay calm, stay aware, and stay apart. Please help us encourage the public to practice social distancing and self-isolation in the days ahead, in conjunction with Governor Edwards' stay-at-home order. Based on the reduced traffic and the amount of business closures we have seen, I'm really encouraged to see our citizens taking this seriously. As you may have heard, since this pandemic first threatened our community, we as a united community have taken extraordinary measures to protect ourselves. However, our resources only can go so far. For that reason, I have appealed directly to the White House yesterday for assistance. In a letter to the President, I called on him to immediately increase domestic production of medical supplies and personal protection equipment. These are badly needed, as you know, for our healthcare providers and our first responders. I wrote that we have been exhausting our supplies and have contacted all viable sources with little to no success for resupply. We also appealed for resources to stand up and expand our local emergency shelter capacity for our homeless community. We need HUD to provide emergency and flexible funding so we can help alleviate the spread of the virus amongst this very vulnerable population. Along with this appeal, I signed a letter with the U.S. Conference of Mayors last Friday requesting $250 billion of direct emergency assistance to cities. Quite frankly, local budgets were not designed for a pandemic, and so we need federal assistance. I'm encouraged to see that the President approved Louisiana's major disaster declaration request on the same day the governor submitted. That is optimistic news. This is the same level, of course, of declaration that goes into effect when a major hurricane goes through our community. This could activate a wide range of federal programs, including individual assistance, public assistance, and hazard mitigation. And it is my hope we will see a financial relief package pass through Congress today. We are closely monitoring hospital capacity and ICU capacity daily in partnership with the Louisiana Hospital Association and the Louisiana Department of Health. Today, capacity is not an issue in our community, but if we do not flatten the curve and if we do not slow the spread, it will become an issue in the coming weeks. Hospitals are working to increase critical care capacity across our community, and we have healthcare professionals here who can answer specific questions about hospital capacity or testing criteria after my comments. As important as it is to sound the alarm and encourage our community to take the steps needed to protect lives, it is equally important to point to signs of hope during this crisis. And I wanted to come here today to meet the volunteers and highlight their critical work. This community testing site offers a beacon of hope here in East Baton Rouge Parish and throughout our region. Again, I can't offer enough thanks to the healthcare providers who are making this a reality. We are accomplishing something few other cities have been able to do. I was on a conference call recently with the Mississippi River Cities and Towns Initiative as I serve as co-chair, and I recommended that they look at our volunteer site here in Baton Rouge as a prototype to consider in other localities and municipalities across the nation. With that being said, I am going to turn it over to Trey Nelson, who is a program manager with Baton Rouge General, who can offer more specific details about our community testing site. Mr. Nelson?
Thank you, Mayor, President Broome, and thank you all for being here today. Welcome to our beautiful and historic Mid-City campus of the Baton Rouge General Hospital, one of the oldest medical facilities here in the city of Baton Rouge. While the testing center is located here at the Mid-City campus of the General, it is truly a collaborative effort from the Mayor's office, all of our physicians, our clinical teams, and our non-clinical teams. This entire team has worked very hard to collaborate to make this testing site a reality in just a week. And we've been finding new ways of making this process more efficient, safer, and quicker each and every day. It's been incredible to watch the teams from all of the different hospitals work together to address combating the further spread of COVID-19 throughout our communities out here. Ultimately, the goal of all hospitals is to protect the health of those in our community here in the greater Baton Rouge area. This is why these collaborative teams are so important, and this is what they're all about: providing more tests, more healthcare workers, and more resources to the people here in our area. The work being conducted here by the hospitals, first responders, and the Mayor's office is playing a crucial role in the local response to a global pandemic. And this will continue to have a tremendous impact on our ability to further combat COVID-19 spread in our community. Thank you all for being here during this crucial point in our city's history. I'll now open it up for questions.
Can you guys give us any insight into why it's taking longer than what you expect to get test results? Is it because the lab is being, flooded with a lot of request for results, or what is the issue?
That's a fantastic question. The reason why we're kind of seeing some of these slow processes within the test results coming back is because essentially all private testers, government testers, all testers across the country are being flooded all at the exact same point. And even as efficient as we can make the testing sites out here and getting people tested, those centers are still getting a much, much higher volume of tests in one sitting than they generally will get. So as a result, across the country and quite frankly across the globe, testing centers are being overwhelmed with their ability to turn tests around and the pure volume of tests that are coming through.
I have a question.
Go ahead.
So lots of success with people being able to get tested at this site. The numbers show last week starting each day there were fewer tests given because of the number of people coming through. The trend kind of seems to be happening again this week. Is that a trend, or is it too early to say if this means anything?
I think that there's a lot of factors that play into that. As you stated, we saw about 183 people being tested on that first day. And between Monday and Tuesday of this week, we were looking at anywhere between 110 to 120 people being tested between the 2 days per day. I think that has to do with all of us getting on the same page about who needs to be tested, what the symptoms are. I think that our systems become much more effective, and that's where having the different healthcare providers all working together has really been a huge benefit, because every day we've been able to make the system a little bit more effective. So like yesterday, we saw roughly around 100 people from the start of us testing to the 1 hour marker following that testing start point get tested. And those numbers are fantastic. And 100 people in an hour is incredible. And like the governor said, the end goal is to provide as many tests per day as possible, because the more tests per day that we provide, the greater understanding we have of what things are looking like and what the current conditions are like here in Baton Rouge. Go ahead.
Yes, you guys are currently working on flattening the curve. What efforts are being taken to flatten that curve, and what's the next steps to continue on with that process, and how long do you think it will take?
I think that between the mayor and the governor's initiatives in the city to kind of slow down the capabilities of people gathering in large gatherings has helped out phenomenally. I think that us as a hospital and here at the General, and then also all the healthcare providers in Baton Rouge, being very, very quick to address these testing sites has been something that's definitely helped, because with flattening the curve, that first key point in all of this is to test. Because before we know how many people have confirmed cases of the coronavirus in the community, we can't move into the process of flattening the curve. So I think that we've ramped up the testing capabilities that we have and our efficiency in testing, and then that combined with the initiatives from the government has aided us in being able to work towards this next step, which is going to be flattening that curve out.
May I add something to that?
Go ahead.
Thank you so much, Trey. You certainly, and please stay close by, but not too close. You know, this is a critical moment in time for our city and for our parish. And so we, the government, we have been promulgating, the governor, myself, others have been promulgating and consistent with a message of social distancing and the need to stay at home now so we can flatten the curve. Now, after we continue to say that over and over and over again, it then becomes personal responsibility of every citizen to adhere to this. It then becomes the personal acknowledgement of every citizen to understand that we are in the midst of a crisis that could impact us for decades to come. Now, the good news is if we adhere to the stay-at-home order, the social distancing, the hygiene habits, then we can be on a good trajectory of recovery and recovering from this pandemic that is touching us nationally. As you heard the governor say the other night in his message, per capita, our rates are going up. So this should be one of those aha moments and a clarion call to everyone to encourage your family, your friends, your neighbors, everyone to take this seriously so that we can move forward beyond this and indeed have a safe and healthy community for the future. I don't know about you all, but you know, I have grandchildren, and I want my grandchildren to move beyond COVID-19 into the bright future that awaits them. But my grandchildren, somebody else's children, our students in school, they won't have that if we don't take this seriously. So I am imploring and appealing that people take this very seriously when we talk about flattening the curve.
Can we go back to testing right quick? Is there ability at the drive-through testing center to do tests where results can come back in an hour that we've heard at some other labs, the private labs, that they're able to do that for their patients?
Right now, our testing capabilities are within the parameters of the actual testing agencies themselves. So at this testing site out here, our capabilities are only within the ability of the actual testing site. There are companies out there that are looking at making that process a quicker process, but as of now, we're working with the time frames that we currently are in. And that's also, it's worth noting that the coronavirus is something that affects every facet of society in a different way every hour of every day virtually. And as a result, our response to it is one that is continuously changing literally every hour of every day. And that is something where if new testing capabilities do come, healthcare providers are working day in and out to make sure that we have that information available. We have people who are working from the minute the sun comes up to the point where the sun's down every single day of the week on this stuff.
Are these tests being processed by LabCorp as far as the commercial labs?
Yes.
Okay. And so the LDH has started to report commercial test results received. Have any, you talk about a long turnaround time though here, have any of the results from this site been reported to the Department of Health?
The tests that are reported after they're either confirmed positive or negative are then reported to LDH. There was a mandate put down by the governor at the start of this epidemic that has required all testing facilities to report that to LDH, but we are also asking that all physicians, when they receive a positive or negative, to also report that to LDH.
Identify yourself.
But, sorry, go ahead.
My name is Jared Heimwitz. I'm the director of Mayor Broome's Healthy City Initiative.
So considering though the long turnaround time and that this testing center was stood up a week ago, have any of those results from this site been reported to LDH yet? And if so, how many?
So we can't confirm that. As the testing site, we're only here as a member of the process of testing. Physicians can only report that. Our partners have told us that they have started to receive testing as of last week, but we can't confirm or deny that because we do not receive the testing results. We are only in the process of helping to supply the tests and get them to the lab.
We're going to do one more question and then we're available afterwards, of course.
Mayor, this is directed toward you. A lot of these hospitals are individually seeking help for medical supplies. Are there any plans to have one location for everybody so that they're divvied up evenly since everybody's kind of struggling right now?
That's a great question, and our goal is certainly to have one location. Right now, the center is at the MOSEP Center is where we will be accepting all supplies, and certainly we can distribute them to our local hospitals. You're absolutely right. Every hospital needs supplies. And so the central location to deliver supplies is at the Mayor's Office of Homeland Security and Emergency Preparedness. We assure you our hospitals will get the supplies because we're working collaboratively with them. And once again, I can't thank our hospitals enough. We have representatives from all of our hospitals and clinics, the Baton Rouge Clinic at Sylvie, we have Ochsner, we have Our Lady of the Lake, Baton Rouge General, everybody is out here. And I think this is another significant moment in time that you see our hospitals have united around a common critical cause in our community, and that's to fight COVID-19. So I can't thank our hospitals, our healthcare providers enough for the unified effort that they have shown in this fight against COVID-19.
And one more.
That was supposed to be the last question.
Just one more.
And you get one. And then that is the last question.
Are you satisfied with this stay-at-home order?
Am I satisfied with the stay-at-home order?
Yeah, and if things were to get worse, hypothetically, do you think it could turn into maybe shutting down the whole entire city probably at some point?
I believe that, and I hope and encourage people to adhere and to comply with the stay-at-home order. As I said earlier, right now I do see a difference since the stay-at-home order has been mandated by the governor. And I will tell you this, prior to the stay-at-home order, I was receiving text messages and communications from individuals concerned about the health of our city and parish, encouraging a stay-at-home order. As you know, this is a fluid situation. Things are changing moment by moment. So right now, it's a stay-at-home order. It could move to a whole nother level if people do not stay at home. But let's stay at home and let's get through the next 2 weeks. Last question.
So you mentioned when you, with your declaration requesting for the president about the homeless population. What's being done with that, with the homeless population in regards to preventing this virus from spreading?
So we have been in collaboration with those stakeholders, those nonprofits who work directly on the ground with the homeless population. We're going to be rolling out a major communication about what's taking place, but I can assure you that right now those advocates who work with the homeless population have implemented a process, especially for those individuals who are in encampments, and we're going to be giving and offering specific attention to those individuals. I want to thank right now St. Vincent de Paul. It Takes a Village, Church Under the Tree, who have been offering demonstrative and consistent leadership for our homeless population to work through this COVID-19 crisis. We will be empowering them, and we will talk more specifically on what that looks like. Thank you. Thank you all so much.
With the experience and resources for cases throughout Louisiana, Walters Papillon Thomas Collins, LLC, is proud to support LPB, specializing in personal injury and wrongful death, with information at lawbr.net.